China was once ravaged by malaria. In the 1940s, it reported 30 million cases of the disease annually. Since the founding of the People's Republic of China in 1949, the country has waged a decades-long battle against the disease. It was finally declared malaria-free by the World Health Organization in 2021. In this long-standing and hard fight against the deadly disease, Chinese doctors and other medical professionals have gained invaluable experience and developed effective anti-malaria drugs based on traditional Chinese medicine. This experience, along with drugs, has proved to be beneficial for the whole of humanity, as many Chinese doctors have gone abroad and joined the global fight against malaria.
In 2006, we went to the African island country of Comoros. Until 2014, we gave our treatment to 800,000 local people. Thus, we helped the country reduce the morbidity rates of malaria and avoided any deaths caused by the disease.
当时是2017年1月16号，属于一个紧急援助项目。
I remember it was on January 16, 2017 that I arrived in the country. It was an urgent aid mission. It took us nearly a year to visit the whole country, inspecting the malaria conditions of each village. In total, we visited 291 villages and gathered data about 160,000 people.
In this edition of Footprints, let's follow the two doctors called São Jianping and Mingqiang to see how they carried out anti-malaria work in countries hit hard by the disease. In 1963, China dispatched its first medical aid team overseas. Since then, nearly 30,000 Chinese doctors and other medical personnel have worked on the front line of combating diseases and improving health in more than 70 countries and regions. In total, nearly 300 million patients have benefited from their medical work and devotion. Dr. São Jianping, who is nearly 60 years old, is one of those doctors. Coming from the Guangzhou University of Chinese Medicine, he has long been engaged in malaria prevention and control in Asia and Africa. His foreign aid missions started with Cambodia in 2000.
I remember I was working at a hospital in Battambang province, a region near the Cambodia-Thailand border. At the time, residents there were ravaged by malaria. Many people died. So, the Cambodian health authorities asked China for help. A 4-member medical team, including 2 doctors and 2 chemists, were sent there. I was one of the 2 doctors.
Sung recalls that their living and working conditions were very harsh. Oftentimes, they had to visit the villages and stayed there for days to conduct research and treat patients. He says the sanitation in the villages was poor, with no clean drinking water. Thus, he and his colleagues lived under the threat of such diseases as acute gastroenteritis and dengue fever. It was in such an environment that São Jianping and his colleagues committed themselves to their work. Sung and his colleagues were working around the clock to save the lives of the malaria patients.
We used artemisinin developed by China to treat the patients. During this process, we were also carrying out medical research to see under what conditions this Chinese drug would be most effective in curing this disease. We worked with diligence and patience.
Based on their observation and research, Dr. Sung and his colleagues soon developed an effective therapy centered on artemisinin for patients suffering from cerebral malaria, a severe form of the disease.
We applied our therapy to 50 patients in Cambodia. It turned out that the cure rate increased to more than 90%. Previously, the cure rate based on other therapies was about 50%. In our work, we tried our best to take good care of Cambodian patients and save their lives. So our work was recognized by Cambodian doctors. They said they would like to learn from us.
Overall, the Chinese doctors' anti-malaria work has helped Cambodia make steady progress in stamping out the disease. At present, Cambodia is well on its way to achieving its goal of being malaria-free by 2025. In total, Sun Zhengming worked in Cambodia for 5 years. After Cambodia, Sung and his colleagues embarked on a new journey. Their next stop was Comoros, which was plagued by malaria when he went there. In the eyes of local Comorans, malaria used to be a plague that brought crying and screaming. Children under the age of 5 were not given names because of the very high malaria mortality rate among children. While trying their best to cure malaria patients, Sung and his colleagues proposed a preventative approach in 2006 so that the disease could be rooted out of the African country. The malaria virus has to incubate in 2 stages to become viable, first in human plasma and then in mosquitoes. Sung and his fellow traditional Chinese medicine doctors and researchers used a form of artemisinin to keep the pathogen from maturing in humans, so there was no disease for mosquitoes to spread.
In 2006, we went to the African island country of Comoros. Until 2014, we gave our treatment to 800,000 local people. Thus, we helped the country reduce the morbidity rates of malaria and avoided any deaths caused by the disease.
For what he and his colleagues had done for the country, Sung Jianping was awarded by the Comoran government. In August 2013, Fuad Muhadji, then Vice President and Minister of Health of Comoros, honored the Chinese doctor for his work in fighting malaria in the island country. Muhadji gave a certificate and medal to Dr. Sung at a ceremony in Beijing. When recalling his past work, Sung says it is just part of the overall story of the contribution of Chinese medicine to the health of humanity.
When we work in a foreign country, its government and people pay great attention and respect to Chinese medical experts, Chinese artemisinin, Chinese experience, and Chinese solutions.
Sung's effective and rewarding anti-malaria work overseas was made possible only after his own country gained invaluable skills and experience in combating the disease and developed artemisinin-based drugs and medical solutions. Actually, China, with its vast population, was once a major malaria endemic country. Since the 1950s, the Chinese government and medical staff have carried out sustained efforts to stamp out the disease. In 1967, the Chinese government launched a nationwide research program aimed at finding new treatments for malaria. This program led to the discovery in the 1970s of artemisinin, the key component in many effective anti-malaria drugs available today. The breakthrough was made by Chinese pharmacologist Tu Youyou, who won a Nobel Prize in 2015 for her research. The discovery has significantly reduced the mortality rates for patients suffering from malaria and helped save many lives globally. For Dr. Mingqiang, artemisinin serves as a magic tool in his fight against malaria in the African country of São Tomé and Príncipe. Dr. Li was born in the 1990s and comes from the Guangzhou University of Chinese Medicine. He has been to São Tomé and Príncipe many times to carry out foreign aid missions. In total, he has worked in the country for more than 5 years.
I remember it was on January 16, 2017, that I arrived in the country. It was an urgent aid mission. At the time, China had just resumed diplomatic relations with São Tomé and Príncipe. With little time for preparation, we knew almost nothing about the malaria situation in the country. Meanwhile, the local people didn't understand our preventive and treatment plans. So the biggest challenge for us was to communicate with each other, to develop mutual understanding and then work together.
Dr. Li and his colleagues were not daunted by the challenge. With the help of local doctors, other medical staff and translators, they went to each and every malaria epicenter across the country.
就花了将近快1年的时间，把他们全国都走遍了。
It took us nearly a year to visit the whole country, inspecting the malaria conditions of each village. In total, we visited 291 villages and gathered data about 160,000 people. As a result, we had an overall picture of the country's malaria situation.
Based on the data gathered, the Chinese medical team then formulated detailed anti-malaria plans, which were centered around artemisinin.
在当时，2019年，他们疟疾爆发最高的一个村。
In 2019, we carried out a trial of out-treatment and prevention plans in one village of more than 500 residents who were hit hard by malaria. Almost half of the villagers were infected. In July that year, we implemented our plans, and the malaria situation was soon under control. 8 months after the implementation of our plans, there were no reports of new malaria cases in the village.
According to the World Health Organization, São Tomé and Príncipe has not registered a single case of death caused by malaria since 2022. The country is committed to reaching the malaria elimination goal by 2030. While great progress has been made, the world can't afford to slacken off in its efforts to combat the disease. In 2022, the global tally of malaria cases reached 249 million, of which more than 90% occurred in Africa, according to the World Malaria Report 2023, the latest available annual report on the disease released by the WHO. The disease killed more than 600,000 people in that year. As the world still faces a daunting task to eradicate malaria, Chinese doctors, including Jianping and Mingqiang, say they will continue to contribute their efforts to this fight.
我们未来的话，然后来不断提高我们的这个综合素质和能力。
In the future, we will continue to improve our medical knowledge and skills, and I hope more young people can join us in the fight against malaria using artemisinin.
With that, we conclude this edition of Footprints. Thanks for listening. I'm Bob Jones. If you're interested in hearing more about the lives of ordinary but incredible people in China, follow us on your favorite podcast platforms. Just key in Footprints and you can find more stories anytime, anywhere. We'll see you next time. Bye for now.